chat. I'm gonna type now. I said, hi, my name is Rachel. I am from Florida. So if everybody who's with me, you can just say your name, maybe where you're from, how many weeks you are if you want. And I look forward to being able to talk to everybody and we can all learn together. Hopefully everybody's Monday has been good so far. So we have Tara from Orlando, Florida, 37 weeks. So it's almost time. Congratulations, Tara. And for those of you who are just coming in, I know I'm just giving some people a little bit more time because we're all coming in now, is we're just saying hello, introducing ourselves, where you're from, and then how many weeks you are. Also so I can kind of gauge what to focus on more. So we have Rihanna from Huntsville, first-time mom, 30 weeks. Congratulations. It's so exciting being a first-time mom. I have two boys. I have a 3-year-old, and then I have a 5-year-old who pretty much is 5 going 3. At least he thinks that he's 40 years old. he talks too much, but he's such an awesome little boy. So I love being a mom, and that's why I started these two. I've been a nurse for 8 years now. I've worked maternity, postpartum, labor and delivery, NICU, even pediatrics. So I love teaching. And then with my first, it was just kind of a different experience with him. So I learned that although sometimes you might be a nurse, you might not necessarily know everything about breastfeeding and baby care because there's only so much the book can teach you until you become a mom yourself. So I see we have Ariel also 37 weeks, 5 days, first time mom as well. So for those of you just joining us, we're just saying who you are, how many weeks you are, where you're from, a little tidbit about you if you want. But yeah, I know we usually have a lot of first time moms here. So it's actually why I became more into this too in the education. So all of you guys probably have access to the online course page. Now, the online course page is the Eventbrite page that has information for you guys. It has the PowerPoint. This is actually my updated PowerPoint now. I had another one before, but what I found was sometimes it helps to have a clear-cut syllabus of what we're talking about, and also steps that you can take when it comes to your prenatal education. So I figured that this is a little bit more focused, but I do have both PowerPoints, so you guys can, at least have access to both of them. And it has lots of great information on my website as well, mommydidyouknow.com. So just a little bit about me. Maybe I'll move the videos around a little bit. But my name is Rachel. This is pretty much my class as well. So I've been a nurse for about 8 years now, like I said, for those of you guys coming in. And I thought I knew everything, but then after having my first Mateo, I realized that there really is a lot to learn when it comes to newborn care and learning about your baby and pregnancy and delivery. It was a very different experience with him. What I noticed, I went through a very long delivery process. It was 18 hours in labor. I didn't really know how to push. I pushed for 2 hours. I was in a lot of pain, a lot of fear, a lot of doubt. I thought I knew about breastfeeding, but then when I put him to the breast, I remember even it was so painful, and I had a lot of bleeding and blisters and sores. And I just thought to myself, oh, if the baby's just nursing well and sucking, doesn't that mean that the baby's, doing well? And I didn't know that if the baby's hurting you, and then obviously you got to change something up. So he ended up with jaundice issues, bilirubin issues. He was on and off phototherapy for a week. And then I dealt with a lot as a parent, also as a mom, like, what am I doing wrong? How come I didn't know about labor? How come I didn't know as much as I thought about delivery and feeding my baby? And what I kind of felt like I was dropping the ball a little bit. So then when I found out I was pregnant with my second, I definitely changed a lot. I did a lot of research. I researched about labor and delivery. I researched about different pain methods, just to kind of also everybody has different goals. You know, some of you guys want to do the natural birthing methods or the non-medicated methods is what I say too, because pretty much birthing is natural in whatever way that you are doing it. You know, it's just a matter of what your goals are. And then in order to achieve your goals, you just want to make sure that you're educated according to the methods to make your goals a reality. So with my second, I learned a lot more, and then I pretty much developed this 8 steps to a prepared childbirth. That is basically like a syllabus of childbirth education that everybody should follow, that will be able to help you achieve your goals, just especially because everybody is different. There's not one size fits all prenatal class. Otherwise, you let me know what it is, that will be great. But it's like, you know, we have some moms here are first-time moms, other moms are 5-time moms. We have some moms that want to have an epidural, some moms don't, some moms want to breastfeed, some moms want to pump, and every mom is different, every baby is different. You're even a different person from one baby to the next. So this class is basically going to help you to have a clear-cut roadmap of what your educational needs will be for your specific goals. And that's why it's so fantastic. I work a lot with my patients as well to make sure that their goals are complete. I do consultations. If you check on mommydidyouknow.com, there's more information about it, and I'll be able to give you more information later as well. So we're going to talk about pregnancy first. Let me see if I can move these. And then if you guys have any questions at all during the presentation, please just let me know. I'd be more than happy to help you out. So number 1 for pregnancy is understand your body during pregnancy. So there are many changes that happen with your new baby. So especially in the beginning, as you know, you'll have your morning sickness. I already, especially with both of my kids, I had really bad morning sickness, really bad nausea. But then at least what I found was when you start to realize the changes that are happening and what you can do to combat it, it makes it a lot easier. So what I found with my nausea is smaller meals was a huge thing. If you can actually eat, I had a little bit of hyperemesis with my first, but water really helps. Smaller meals really help. Try to limit your caffeine and your grease, especially that really helps with the morning sickness. Frequent urination, especially in the beginning. I was actually surprised to find out that frequent urination can actually be in the beginning of your pregnancy and in the end. For some reason, I always think that you'll urinate more in the end if, you know, the baby's bigger and pressing against your bladder, but you'll actually be urinating pretty frequently in the beginning, as of course, there's so many changes taking place in the fluid that is circulating throughout your uterus and your body as well. Fatigue, especially as all of the energy is going towards your baby, you're going to be a little bit tired. What can really help with that is trying to have a nice exercise routine. I do go over exercise routines, both prenatally and postpartum, if we ever do get the opportunity to talk just one-on-one. We do have sometimes heartburn. What helps with that is try to keep your grease to a minimum. Try not to eat too much right before bed. And then if you do eat, try to also be upright. And then if anyone is dealing with anything during your pregnancy, whether it be nausea, fatigue, frequent urination, insomnia, you can write it on the chat box too. And then I can give you a few extra tips on how to overcome it. But I'll just give you a little tidbits for each one. So these are to be expected. We have our morning sickness, our urination, fatigue, heartburn. Sciatica is basically the pressure on certain nerves cause a very sharp pain to go pretty much from your legs all the way up, sometimes to your back. And I remember with my second, I had it really bad. And what really helped was a binder that I had around my belly and my back and my hips especially. I found that if my hips were well supported, that sciatica really got a lot better. I don't know if anyone's dealing with sciatica as well, but for me, it was awful to deal with that. I remember I would have my patients and I would be checking, doing fundal checks. And then just as I'm bending down to do the fundal check, I would feel that sharp pain go all the way up and down. So if you are dealing with it, you are not alone. I feel you there. Emotional symptoms. Does anybody know the difference between baby blues and postpartum depression, by the way? So you can write in the chat box, the same chat box that we were introducing ourselves. Does anybody know the difference between baby blues and postpartum depression? Now, this is really important to note, just because especially you might have some emotional symptoms throughout your pregnancy and even after, but it is really important to know how to tell the difference between when that baby blues turns into postpartum depression. And I will give you guys a second. Now, what's really great about this class is it is very important to try to stay interactive as well, just so that you guys can truly learn, take something out of it. And then also it's just a way that we can get to know each other also. But postpartum depression, a big difference is that it lasts longer than the baby blues. So one thing with the baby blues, sometimes it might last a few days, sometimes a few weeks. And then postpartum depression, a huge thing with postpartum depression is that it gets in the way of daily life. So for example, someone with postpartum depression, they might not want to get out of bed. They might want to stay in their house. They don't want to be hanging out with other people, although sometimes it might be hard with all the COVID things going on, but usually that is a big difference. With postpartum depression, that starts getting in where all of a sudden they don't want to hang out with their friends. All of a sudden they don't want to hang out with family. They don't want to have support. Their activities of daily life is really delayed. And that's a huge way that you can tell the difference between postpartum depression and the baby blues. Now, next that we have insomnia, especially as the baby's getting bigger, it's going to be hard to sleep, especially in the third trimester when the baby's getting bigger, especially, and then the baby is pushing against your lungs. So what really helps is a left side lying position, even a right side lying. Research actually does not have that much of a difference between left side lying and right side lying, as long as you're not like laying flat on your back. That's going to be a big difference there. Aching back and pelvis, that also goes back to the sciatica. And nasal congestion. Just if you do have nasal congestion during your pregnancy, make sure you're not using Afrin, but you can use like saline, you know, those are fine, or even the neti pots where, you know, I hate those things where they kind of just circulate all through. Those work also, but it's just the hormones sometimes will cause some nasal congestion. And then complications in pregnancy is really important. So this is our first stop for just preparing for delivery. Is our first step is we're going to find out how delivery and pregnancy affects our body. So we were talking about morning sickness, urination, fatigue, all that good stuff. Now, those were the normals. Now it's important to understand the abnormals as well. Especially as a nurse, I try that my patients really understand the abnormals. Make sure you guys are drinking water too. I really have to drink more, but so the abnormals such as preeclampsia. Can anybody tell me what is preeclampsia or even eclampsia? And you can write that in the chat box. And don't worry if you're not completely correct, I won't bite you. It'll be a little difficult to bite across from the screen, but preeclampsia, you are very close. Preeclampsia is high blood pressure, exactly. And yes, whoever's on Alex's iPhone, you are very good because you're right. So it's hypertension and protein in the urine. So preeclampsia is high blood pressure. Hypertension is the scientific name or the medical name for high blood pressure. And a lot of the times it is also noted by protein in the urine. So a lot of the times you might be going into your doctor's office and they'll be checking your protein. And then basically what that's doing is if you have, let's say, +2 proteins, +1 proteins, and your blood pressure is high, that is preeclampsia. We're looking at preeclampsia and eclampsia. Eclampsia is when you start getting into those bad symptoms. So complications of preeclampsia and high blood pressure can be seizures, which is really bad. All of a sudden you'll start having blurred vision. Sometimes you'll start having those little dots. And then if it gets really bad, it can have seizures. It can even have, if the blood pressure goes too high too fast, it can even cause a premature abruption of the placenta. Placental abruption is when the placenta prematurely kind of ejects itself from the body because of that increased blood pressure. And then sometimes even babies with high blood pressure, if you think about it, if your blood pressure is high and you're having a lot of Constriction on the blood vessels, your nutrients are not traveling to the baby as much as they could. So if the blood pressure gets up too high too fast, your baby's heart rate can drop, and your baby can even have a low birth weight. So all of those are symptoms and complications of preeclampsia. Then we have gestational diabetes, which is high blood sugar during delivery, well, high blood sugar during pregnancy. And then blood sugar, normally gestational diabetes is regulated enough with diet, which will be limiting your carb intake, limiting your sugar intake, especially, and then having more water in your diet to kind of balance out the sugars and waters in your body. Gestational diabetes, a huge complication with that is that you can have a very large for birth weight baby. Nobody really wants a baby that's 10 pounds, but you might want a very, very squishy baby. So that's one thing with gestational diabetes is babies are normally a lot bigger. Another thing is if you do have to have insulin, your baby, like let's say you had insulin at 11 a.m. and your baby came out at 12 o'clock. Sometimes your baby's sugar will drop very, very fast just because that insulin's still in the system, or even you were constantly supplying all of that sugar because you're gestational diabetic and your blood sugar is high. You're constantly supplying the baby with all of the sugar through the placenta. Then all of a sudden baby comes out, there's no more placenta. And then all of a sudden you start getting some low blood sugar for babies. So usually gestational diabetic moms, their babies, a big thing is that you'll end up with sugar checks on the baby just to make sure that the baby's okay. Preterm labor is another complication. You might have all of a sudden really heavy cramps. Now, does anybody know the difference between true labor and false labor? So can anybody tell me, how would you tell if you are having true labor contractions versus just Braxton Hicks? And I'll give you guys a minute to come up with some answers. Exactly, Tara, you're completely true. Timing, consistency, that is a huge thing. Timing and consistency. If you're getting regular, intense contractions, that means that most likely you're on the road for true labor. If you're getting kind of irregular contractions, you'll have a contraction here, then stop, and it also goes away on its own. That's normally just Braxton Hicks. And then Rihanna, placement, real contractions are from the top, not the sides. That's a good point. Sometimes you might even have back labor. Another thing is the intensity of the contractions. So if you kind of feel your forehead, feel your nose, feel your chin. So your nose, the intensity of your contraction will be like your nose. So when you feel your belly, it's kind of, you feel it's a little tight, but not that much. That's like your nose. It's a little tight, but not that much. Then you go over here to your chin. That's like a moderate contraction. You feel the tightness, you feel that it's pretty strong, but it's a pretty moderate contraction. Then you go to your forehead. You feel it's really tight, it's really hard, there's really no soft spots at all. Now that is a heavy contraction. So you're having heavy contractions, regular contractions, and they're intense. They don't go away with water. They don't go away with sitting. Those are all signs of true labor and not just Braxton Hicks. And then with every story, with every step, I think it's important to see how other people overcame whatever obstacles that they had by understanding different aspects of the step. So for me, understanding your body, one thing that really helped me was because I was able to understand my body and understand hyperemesis and understand how to overcome nausea, I was able to overcome hyperemesis. I was able to, with my second baby, I knew what to eat. I knew what not to eat. With my first, I had to be medicated for hyperemesis. With my second, I noticed I started out pretty bad, but then I figured out the times that I eat was very important, because if I didn't have a cracker as soon as I woke up, and then I found out that I would get really nauseous. So sometimes even just learning about your body and how it reacts makes a big difference. So if you're dealing with something during your pregnancy, try to see what works and what doesn't. So for example, if you're dealing with sciatica and you like the tight around your hips, you can have that. For me with a sciatica, if I had the nice around the hips tightness, security, it really helped the sciatica. And then number 2 is don't neglect mental preparation. So all of you guys at least are preparing for delivery. with education. But one really important thing is also the mental preparation as well. Remember the power of your words. I don't know how many times I go into patients' rooms and they're holding their baby and they're just like looking at their baby and they're going like this as they're trying to breastfeed, or they're trying to take care of their baby and they're just rocking their head back and forth like they don't know what they're doing. But it's really important to understand the power of your body language and the power of your words. So before you get into your labor, before you get into your delivery, and then even when you're having your baby, remember the power of your words, remember the power of your body language. So your negative talk will in turn have negative emotions and negative behavioral consequences. So remember, positivity, positive support system, positive words of affirmations is so important during your pregnancy, during your childbirth, your labor. And then that goes into even like now I know the big craze is hypnobirthing. We can talk about that a little bit as well. That's the biggest segment of hypnobirthing as well, is just the positive affirmations, words of affirmations, the positivity. Exactly. Like in spiritual midwifery, the body-mind connection, very, very similar. Exactly. I'm a firm believer that your body and your mind are connected. So if you have negative thoughts, negative emotions, and people speaking negativity to your life, that it will in turn have a very negative impact on your life. So if you have somebody, for example, that's speaking words of negativity or words of doubt into your mind, especially when it comes to your abilities as a mother, try to steer away from them. I know that some people you can't, avoid them completely, but, be honest with them, hey, I would really appreciate words of positivity right now. I really would encourage more positive thoughts. You can even tell them things that you want to hear versus the things that they are saying. And that makes such a big impact in your life. And don't neglect what gives you joy, especially I know sometimes right now we're dealing with the COVID crisis and all of that, but don't neglect what gives you joy. If you love music, listen to music. If you go to church, keep going to church or looking at your, a lot of them have streaming. If you're a book club member, read those books, especially now we need to have those support systems. We need to have those connections, and it makes a big difference. That's why an entire step of this series is just on your mental preparation, just because it makes such a big difference to feel connected, to feel like you are doing things that you love. Because although we are mothers, and all of us here, we are mothers, but that is not the only thing that we are at this point also. So we also have to think about, what do we love? That's self-love, self-care, and it makes such a big difference into your prenatal care. And then keep your support system close. I know that sometimes when you're doing a million things, you forget to text your mom or text your friend or, even your significant other, your husband. But keep them close, keep your support system close, and accept help. Sometimes that's a big thing, just accepting help when need be, if you need it. And then, prepare your hospital bag, nursery goals before going into the hospital. If you're somebody that wants to delay cord clamping, make sure that you let your medical staff know. If you're somebody, let's say you're getting your epidural and you want to have the Foley in after your epidural is placed, sometimes those are certain things you want to think about. Now, I have a great prenatal package that I talk about as well, that kind of helps you prepare your hospital birth plans, helps you prepare your goals before coming in, what terminology to use for your doctors as well, when to prepare your hospital bag, what is necessary for your nursery, what is not necessary for your nursery. Those are so important. So at least you'll be able to be well prepared coming into your delivery. Now we have a case study, Jocelyn. So I once, actually quite a few times, I work with moms who are first-time moms. And how many of us are here are first-time moms? I know that we had quite a few first-time moms here. I know we had at least 3 first-time moms. But one of the biggest fears that first-time moms have is the fear of the unknown. So exactly, Tara and I'm sure a few other people, Rihanna. Now you guys as first-time moms, the biggest thing that you have is the fear of the unknown. What is going to happen? What do I do if this happens? What do I do if that happens? How do I hold my baby for the first time? There's a million questions going into your mind. But the best thing you can do is prepare, and know that you're not going to prepare for everything, and that's okay. So you can keep me as your support system as well, because I'm here. Keep with other support groups, mom support groups as well. So one time I did meet with Jocelyn, who was very fearful of being a first-time mom. What I do is I have these prenatal classes, I have other prenatal classes, online classes, and what was the beautiful thing is that she came in and her doctors were like, are you a first-time mom? Are you really a first-time mom? Just because she already knew how to take care of their baby. So I applaud you guys so much for being able to prepare for the delivery, looking into all of these things, because all of these will make a big difference for when the baby comes in. Now, keep in mind, you're not going to be knowing everything right off the bat as a new mom, and that's okay. But what you can do is prepare as much as you can. Prepare your mind, prepare your body, and it makes a big difference. Then we have step 3, labor and delivery. Know how the body progresses through childbirth. Now, this is a big section for everybody. Everybody always wants to know about this part. So we talked about step 1 was knowing how your body progresses through pregnancy. Step 2 is mental preparation. Step 3 is knowing how your body progresses through childbirth. So to be expected as you get a little bit closer to delivery, 1 is lightening. As your baby starts to press more on that pelvic canal and that, especially that pelvic girdle, you're going to feel a little bit of lightening as your baby gets starting to move down. It's pretty much like lightning that comes up all the way down. It's like sciatica though, where sciatica is more related to your positioning. Sciatica would be more like, you bend down and all of a sudden, boom, you get like a sharp pain all the way up. Lightening is you're kind of feel it also more in the pelvic region as well, in the vaginal area also. You might have a little bloody show, but keep in mind that bloody show, mucus plug coming out, water breaking, those are signs of labor, but that does not necessarily mean that you are not in labor until you lose your mucus plug or until you have a bloody show or your water is breaking. You can be in labor before that. The biggest thing to know is if your contractions are regular, that they're intense, and that they are not going away with fluids and they're not going away with resting. Your water breaks, by the way, if your water breaks, try to keep in mind the smell. That's a big thing. If it has a weird smell, make sure to keep an eye on that. And then if it has a weird, if it's not clear, that's another thing. If it's not clear or if it has a weird smell, keep note of the color and keep note of the smell. And let your doctor know, let your medical team know when you get to the hospital or wherever you will be delivering, let them know, hey, it was a little tinged like green. That can be like meconium or black. It had a little blackish tinge or a green tinge. And sometimes that can mean that the baby's in distress, because that's what, if you ever heard meconium stained fluid is basically the baby's in distress, poops before delivery. So then that's when you'll have the meconium stained fluid, where the fluid will actually have a different color. Nesting is, a little before you have childbirth. You might have some nesting, where actually all of us pretty much go through nesting. I definitely did. Regular contractions, like we mentioned, the ring of fire. So when you are getting closer to delivery, you'll have different stages of labor. The first stage of labor is when you're dilating from 1 to 10. Some people, they take longer to dilate than others. When you finally are complete, you're gonna feel pressure, almost like you have to poop. That's basically what it's gonna feel like. And honestly, a lot of people, when they do deliver and they do end up pushing, some of them do poop, and that is fine. When the baby comes out, you might feel kind of like a ring of fire as the baby comes out. That's like kind of the best way to describe what a baby comes out feels like. So first, as you are at 10, you'll feel that intense pressure. If you have an epidural, you might not feel the contractions itself per se as much as the pressure when the contractions are happening, especially as you get closer. What I felt, especially when I had one, was that when I got closer to delivery, I didn't really feel the contractions so much in my abdomen, but I felt the pressure, kind of like the urge to push all of a sudden. And then I noticed that it was correlating with the time of my contractions. Although keep in mind that If you do have an epidural, sometimes the pressure that you'll feel is a little delayed compared to the contraction time. Now, if you do not have a medicated birth, if you're having a non-medicated birth, which is absolutely fantastic, more power to you, you'll be able to feel those contractions. When you do feel those contractions, there's different ways of decreasing the pain of that contraction. One very important thing you can do is have a focal point and focus on your breathing. That is for non-medicated and medicated at the same time. But one great Lamaze technique that's super easy is you just pick a focal point. That's the most important part. And then you breathe in through your nose, a 6 count. You hold for a sec and then breathe through your mouth, a 6 count. So it goes in through your nose, out through your mouth, 6 count. When you are pushing, there's different methods of pushing. There's gentle pushing, where when it's time to push, and you can always like look up these techniques. For me, I'm a big preparation is key person. So I look up a little bit about every technique and then just put it all together, whatever works for you. But there's a gentle pushing technique where pretty much you'll lift up your chin for a little bit. So you're gonna lift up your chin as you're pushing. You get a nice breath, and then you will gently breathe out as you bring your chin in and tuck in, and you breathe out 6 counts. Then after the 6 counts, you will lift up your chin, get another breath in for 6, put your chin back down, and then breathe out 6 as you are pushing. When you're pushing, make sure that you are not pushing with your vaginal area, you're not pushing with your pelvic area. Try to push more from here down, because what I noticed is when you try to push more from the vaginal area, or if you try to push when it's not really time to push or you're too early, sometimes that's when you can tear a little bit more. So sometimes just even pushing in the right time and pushing gently rather than having too much air come out, or you know, if some people are like you're screaming too much, that can cause you to push more, to tear more. So at least by making sure to breathe right, having more gentle pushes, not yelling too much, things like that can help. Some people even delay pushing. So there's a technique called delayed pushing where they will, let's say you're complete, you're at 10, you know, sometimes they're like, all right, you're at 10, let's go, boom. You know, they'll check the station of the baby. They're like, okay, the baby's at 10 station. Let's go ahead and push. There's one technique called delayed pushing. So like I said, all of these techniques, you can kind of read through all of them and kind of pick and choose what works for you, because like I said, everybody's different. So there's a delayed pushing is basically you wait until you're at 10, and then you wait for your body to receive the signal by simply waiting for 30 minutes, you know, or more. For me, I found it so hard to wait. So of course, if like you're at 10 and you're like ready to push, go ahead and push, you know, if you feel it. But if you're at 10 and you're not really feeling that urge to push, and you're not really feeling that pressure to push, that is when they recommend, okay, maybe delay the pushing for a little bit. But of course, you would want to talk to your medical team, make sure that the baby's okay, the heart rate's okay, because as the baby's getting closer to delivery and moving closer down, that's when you also want to make sure that there's no complications with the baby. And then I have complications on this other side of normal heart rate. That's when the baby's heart rate starts to drop, such as, let's say the baby's coming out. What you'll notice, and it can be normal, is as you are contracting, your blood flow to the placenta is decreasing for a little bit. And as it decreases for a little bit, blood flow to the baby blood is what carries oxygen. So if you are contracting and your uterus is contracting and you're decreasing the oxygen to the baby, sometimes the heart rate will drop a little bit. Usually what you'll notice is if it's normal, if it is early deceleration. So if you hear that terminology, so if you guys do sign up for my program, when you hear the terminology, I have a whole section on labor terminology and pushing methods and pain relief methods, all that great stuff. When you hear early deceleration, don't be so concerned. Early decelerations are normal. Those are just as you're contracting, sometimes the baby drops the heart rate a little bit. Now, if you hear late deceleration, that is usually a problem with the cord, like the cords around the neck, something like that, because what's happening is the contraction is happening And then after the contraction happens, there's a delayed response, and then it's a late deceleration. The baby's heart rate drops after the placenta, after that contraction happens. So when that happens, that is more of an emergent situation where they will first try to move you to the side. They'll try to release the cord around the neck by moving you to the side. They might decrease the Pitocin as well. If you have Pitocin, they'll have different things like that to try to get that baby's heart rate back up. And then if they cannot get the baby's heart rate back up, that's when you have to go into, the discussions, hopefully not, about cesareans and different things like that. You might have lacerations as well. What helps lacerations are dermoplast spray, Tux pads are fantastic, SIDS baths, those are great. Complications, failure to progress, that is when, you're trying really hard to deliver, but for whatever reason, your baby is just not progressing through labor and delivery. Your dilation's not happening. What really helps with that is just trying to relax, take a breath, and then hopefully get your pain managed. And sometimes that helps to progress. You get some nice, confident affirmations, positive affirmations. Shoulder dystocia. Does anybody know what a shoulder dystocia is? So I'm going to be testing your knowledge. Who knows what a shoulder dystocia is? And as a nurse, it can be one of the most frightening things to witness, but a shoulder dystocia is when the baby comes out, the head comes out, and then the shoulders get stuck. So that's one of it comes out, so you're close. So a baby comes out and then the shoulders get stuck, and it can be even like one arm gets stuck. So you were correct with that. It can be even one arm gets stuck and then the other shoulder gets stuck. But what happens with a shoulder dystocia is there's cutting the blood flow to the baby until the baby comes out. So usually they try to keep shoulder dystocias to less than 30 seconds. So if that were to happen, you would expect your nurses to come and put pressure, pelvic pressure, to try to get that baby out. In extreme cases, they might even have to do a C-section emergent, but usually they're able to do the extreme pressure, or even sometimes they might have to move the clavicle a little bit. That's one of the biggest complications of shoulder dystocia is clavicle fracture. If the baby does have a clavicle fracture, and sometimes they can even have a fracture without having a shoulder dystocia, just because baby's bones are so fragile. Usually they don't require surgery or anything. It's usually just a splint that they'll have for a few weeks, and then you'll have to follow up as needed. We already talked a little bit about umbilical cord issues and malpresentations, another complication where the baby is not at the correct space for, the correct presentation for delivery. So even though the baby should be head down, the baby is feet first, something like that. Case study, so distinguish true and false labor. So I had someone come to me and she wanted to know, she was having contractions, and she wanted to know, how do I know that I'm having true contractions and I'm not having false contractions? So what would you tell Genesis? So she was one of my patients that she just asked me questions. So all my patients get like 24/7 support, so I can always ask their questions whenever they have. But what would you tell Genesis? So if she wanted to ask you, how do I know that I am in true labor and I'm not just having Braxton Hicks? And I'll give you guys a second to think about it, but think about all the stuff that we talked about. So you can tell Genesis that true labor will be more regular. True labor will be more intense, especially you might get more than just in your nose, but you might have it more like your chin or even your forehead when you feel the contractions. You'll have more regular intervals, exactly. And also they do not go away with rest. So normally when I have somebody say, oh, I don't know if I should go to the hospital, I'll say, drink, like, you know how they have those gallon of water or even half a gallon of water. I'll say, drink one of those and lay down for 30 minutes or an hour. See if it goes away. If it does not go away, and then you might be in true labor. If it goes away, and then that would probably was Braxton Hicks, which is good. Your body is preparing for delivery. So very good. Now, understanding exams and treatments. I'm not going to go over this too much, especially because everybody will have different exams. But normally you'll have a CBC, which is a complete blood count, rubella, HIV, Hep B, GBS, RPR. Those are pretty much the prenatal panel that most moms get. PAH labs is pregnancy-induced hypertension labs. Those are for moms that have hypertension. They will, in addition to the normal CBC, they'll also get a basic metabolic panel to see especially their liver enzymes, because we want to make sure that someone does not have an extreme complication called HELLP syndrome, where their liver enzymes become elevated and their blood pressure comes really high. And then they also end up with hemolysis and anemia. So we're especially making sure that people don't have HELLP syndrome, because that can be a potentially life-threatening syndrome, especially after the baby is delivered. So those are like high liver enzymes, decreased hemoglobin, so you'll have anemia, and then high blood pressure as well. So those are like the 3 threes of the HELLP syndrome. And then newborn tests all depend on, you know, the situation between mom and baby. So for example, sepsis workups, let's say you had a long rupture time, your rupture time was over 18 hours. Let's say the baby is premature and you had a premature rupture of membranes. They want to see, does the baby have an infection? And that's why the baby came early. Glucose screens, like we mentioned before, is if the mom's gestational diabetic. They also do it if the baby's small, premature, if the baby's big. Bilirubin tests are tests for jaundice. And then if the jaundice test comes back high, usually it's, they would ask for more frequent, efficient feedings. If you're breastfeeding, make sure the baby's latched on correctly, make sure that the baby's transferring milk, compress the breast with the feedings. If you are supplementing, make sure that the baby is supplementing. You can always supplement with your own milk first, and then, you know, as needed. Sometimes if it's extreme cases, they might want formula. And then they'll also have phototherapy. Phototherapy is something that breaks down the bilirubin. And then we have infant screen is different states have different screens. In Florida, we have the Florida infant screen, but for the most part, all states have an infant screen that tests for galactosemia, and they test for amino acid deficiencies. In Florida, they also test for different metabolic disorders like thyroid disorders and things like that. And then cord blood profile, we're especially making sure the baby's not Coombs positive, which is a big indicator that the baby's going to have high jaundice. And then also we're looking to see if mom's negative and if she needs RhoGAM. That's basically if mom's blood type is negative, baby's blood type is positive, she would need RhoGAM, which is something kind of different as well. So Marlene knew that she was GBS positive, and she saved her baby from unnecessary tests and treatments. So the reason is she knew what were signs and symptoms of infection. So remember how we were talking about the sepsis workup, and we were talking about how sometimes babies will have a higher risk of infection. So I wanted to do this case study to tell you guys some signs and symptoms of infection. So who can tell me some signs and symptoms of infection? So let's say you were GBS positive, or let's say your rupture, you know, happened early, or you had a prolonged rupture of membranes, and you want to make sure that your baby is not sick, you know, that your baby doesn't have an infection, or you want to make sure that if your baby does have an infection, that you get seen quickly. What would different signs of infection be? Let's see if anybody knows some signs and symptoms. How can you tell that your baby is sick? Exactly, Rihanna, fever. That's a very, very good one. So even though you might have medical professionals that are with you and they are you know, checking the baby and checking you, it's so important to make sure that you are checking your baby as well, especially if you have different risk factors for infections, such as GBS positive, premature baby, prolonged rupture of membranes, things like that. So one big one is fever, redness or swelling. That could be one. A big one though is tachypnea. Tachypnea is when the baby starts breathing very fast. Normal babies breathe about 30 to 60 times per minute, which is a lot faster than an adult, which is about 16 to 18. So 30 to 60 times per minute. If the baby breathes more than 60 times per minute, that is a huge sign of tachypnea, which is That is tachypnea, which is this huge sign of infection. Another one also is retractions, where all of a sudden the baby starts using accessory muscles to breathe because they can't breathe. Because a lot of the times respiratory, I guess you can say, symptoms are related to infection. So you might have tachypnea, you might have retractions. Another big thing besides the fever also is lethargy. Sometimes a baby, for whatever reason, they're not getting up. So let's say you have your baby 1 week old, and no matter what you do, they have poor tone, poor muscle tone, they're not getting up to feed. Although babies can be very sleepy in the beginning, but a sleepy baby should be able to get up and still have a good firm muscle tone and still have their normal responses and reactions. If they don't, if they have a very poor muscle tone, they're not getting up, they're very lethargic, that can be a sign of infection. So that's why it's really important to know the signs of infection, especially if you have risk factors for infection. So we still have some bits to go through. So I'm going to go over pain relief methods, and then we can do our giveaway as well. The other 3 methods, I'm like, time flies so fast. I just updated this too. So I was trying to figure out how much time we have to spend on each one. Are you guys enjoying this so far? Are you guys learning? I know we have a lot of great information that we had. I don't know what I would have said if someone said, no, they're not learning. But hopefully you guys are learning new things, and that it is helpful for you guys as well. So here are some key pain relief methods. So I personally like to see different pain relief methods and see how they work and see what works for you. Just because everybody's different and everybody's goals are different and your lifestyle is different than mine, what works for me might not work for you. And that's okay. That's why this world is beautiful, because if everybody was the same, it would be really boring. So, and nobody likes a mom shamer. So if you are, whatever your goals are, that's all up to you. But the best way to get your goals achieved is by education and by learning. Especially, there's always stuff to learn. Even sometimes I'll see someone that's like, it's their 5th baby. They're like, oh, wow, I didn't know there was so much to learn. I'm like, yeah. So number 1, Lamaze. Those are your breathing techniques. So what's really nice about Lamaze, the big thing with Lamaze is you're increasing the oxygen that's going to the baby. So like we mentioned before, every time you have a contraction, you're decreasing the oxygen that's traveling to the baby. Therefore, sometimes the baby's heart might drop. So the beautiful part with Lamaze is that it's increasing the oxygen that's going to the baby by having specific breathing exercises. We did mention the one where you pick a focal point, you breathe in 6 and you breathe out 6. One exercise you can do as you are doing Lamaze is you can also focus on a different part of the body that you are contracting and releasing during each breathing exercises. So for example, let's say you have one and you're focused on your hand. You'll focus on your hand. Let's say the next one, you're focusing on your belly. You can focus on your belly. You're focused on your leg. You focus on your other leg. The thing with Lamaze is kind of gate theory, where actually a lot of the pain relief methods focus on gate theory, which is a very interesting theory where it says that your body can only receive a certain amount of stimuli at one time. So then the more you are bombarding your information with stimuli or responses, the more likely it is that it will focus on the positive responses and not the negative responses. So therefore, if you're doing the Lamaze and you are breathing in, you're breathing, that's one response. You are you might even be talking, or you might even be saying something. That's another response. You're having your focal point that you're focused on. That's another response. And then you have that specific part of the body that you are focused on as well. That is another response. So as your body is focusing on all those different places, your body will be focused on that and not necessarily on the pain receptor. So that's basically the biggest thing with Lamaze. Now with acupuncture is not necessarily having the guy come in with all the little needles and stuff, but acupuncture is basically based on the fact that there's different pressure points in the body that stimulate different receptors and different, pretty much different nerve endings. So it's actually really fascinating. So for example, the biggest one with labor that people do is called B48. which is kind of, have you ever seen the gluteal muscle of the buttocks where it's, I don't know if you can kind of see, but if you put your hand around your hip and it's like right above, you know what, you might even, let me see if you'll be able to see from this. Okay, so basically, so it's gonna be right here, okay? Right above, that's your gluteal muscle, okay? And then what you're gonna do is acupuncture points. You learn different acupuncture points that will help stimulate different nerve endings to increase blood flow to the pelvis. And then that will decrease the pain, and it will help to stimulate your contractions and to help promote blood flow and promote your natural labor progression. So the way that acupuncture works is it says, okay, let's put pressure on this point. That will help to promote blood flow to the pelvis. So by that B48 one, for example, is just promoting blood flow to the blood flow to the pelvis. It helps to progress your labor. So I thought that was fascinating, and different points are really interesting as well. So they have like this one, for example, between your thumb and your pointer, that actually progresses labor, and it even moves your labor contractions downward, which is one thing you want to do, is you want to move that contractions downward. And it also helps with like headaches. I don't know if you knew that, but that was really cool. Water birth, the biggest thing with water birth, just in case you're interested in that, is it says that it decreases the gravity restrictions that are on the baby. Therefore, it helps to increase the blood flow, and then decreases the pain because you're not obviously having all the gravity that's focused on the baby. It's easier to switch the positions and move when you're in the water, just because you don't have to deal with all of that heaviness. I personally did not have a water birth, but I'm just giving you guys what each one does so that you guys can make informed decisions. And if you were to have a water birth, that is the big benefit. You get to move. You don't have to worry about the restrictions of gravity and stuff like that. The biggest thing that I would say, though, if you do have a water birth, is make sure you have a thermometer to make sure that the water of the tub is as close as possible to your body temperature. Because if it's too far away from the body temperature, it won't necessarily be as beneficial as it really can. Then there's hypnobirthing, which does a lot of the affirmations, like I said. Especially it says like, your body was made to do this, you can have informed decisions. So by repeating positive affirmations during the birthing process, it is going to give you more control over the birthing process. Then we did mention gentle delayed pushing already. Then of course there's the pharmacological pain relief methods. I think a lot of people are nervous about them because they don't know what to expect. But if you know what to expect, it'll definitely be very helpful for you guys. So number one, we have nitrous oxide is the gas. Very rarely do they use the gas anymore, but nitrous oxide is the laughing gas. We have local anesthesia. Also, an anesthetic is the local anesthetic is like, let's say the baby's coming out and they're going to do an episiotomy, which is that surgical tear to prevent tearing naturally in the perineum. So if you were going to have an episiotomy, usually they'll have local anesthesia before doing that surgical cut. The biggest thing, you might feel a pinch. I did not have an episiotomy with both of mine. I teared naturally. I had a first degree. What I did notice was that, at least from what I hear too, episiotomies hurt more than natural tearing, but episiotomies heal quicker than natural tearing. So it's kind of a catch-22. IV pain medications are short-lived. Those are like Demerol, Nubain. Those kind of make you a little loopy though, but they take the edge off if you don't want to have the epidural and the spinals and all of those. Epidural is a nerve block. So it will block the nerves and the pain receptors from pretty much your hip down. That takes about, I would say, once they take the epidural out, a good 2 hours before you start feeling, your legs back and everything. Spinal, that is walking epidural. They don't have them in my hospital. Walking epidurals, they are a nerve block as well. I have not had that much information about a walking epidural though, but I do know that with the walking epidural, you still have to be on a monitor. At least for the most part that I can tell. You can have a walking epidural if your hospital allows it. You'll still have to be on a monitor, and you still have high risk of of low blood pressure, which is one reason why a lot of hospitals don't like the walking epidural, just because one major risk factor of an epidural is low blood pressure. So then if you have low blood pressure from the epidural and then you stand up, you can fall. So that's one big thing, is if you're woozy or you have a low blood pressure, it might not be the best option for you. But if your blood pressure is okay, sometimes they give you a bolus of fluid before and then give you the walking epidural. Those are fine. If you do have an epidural that's not walking, though, you might have a catheter. And then, like I mentioned before, one good thing you can ask is to have the catheter after you put in your epidural. So those are great things there. And then general anesthesia, if you were to have a section, you'll either have spinal or general, or sometimes people have an epidural and then have, like if they already had the epidural and they're going in for the section, it's going to be fast. Sometimes they just give them a bolus of the epidural without having to do the spinal, but there's only very few anesthesiologists that do that. But that's only like in extreme conditions, because it's either general anesthesia. If it's an emergent C-section, sometimes they might have to do general anesthesia because they don't have time to put in the spinal. That is, general is through the IV where they're completely out. Now, kind of way that they can avoid the general anesthesia is if they already have the epidural, then they just kind of top off the epidural. But they try not to do that. They try to do a spinal if possible. The only thing with the spinal is it usually lasts about 6 to 8 hours compared to epidural, which lasts 2. And then, so my case study, so with my first baby, I was in labor for 18 hours. One huge reason was because I didn't really know how to manage my pain effectively. And then 2, I was afraid of epidurals. So I didn't have an epidural until I was like, pretty much about to get a section because I was not progressing. Now, of course, you know, there's some people that want to do non-medicated. I'm just saying for me personally, I was afraid. So that's why I didn't have it. It was not necessarily like I had something against it or anything like that. I was just afraid. But then when I was able to be educated about what it, you know, what it does, and then I had it with my second baby, I had an epidural and I pushed him out in like 4 hours. Between the time I went to the hospital and pushed him out, it was like 4 hours. And one big thing was understanding pain relief techniques. So of the pain relief techniques that we mentioned, can you guys tell me some of your favorite ones that we mentioned? So you mentioned some pressure points, we mentioned some positive affirmations. So if, for example, let's say you had a friend named Rachel, like me, who was having problems progressing through her labor, and she did not know how to manage her pain. What would you tell her? What would you say? What would you tell Rachel, who is trying to manage her pain? Exactly. So we have the breathing techniques, we have the positive affirmations, we have the hot water shower. That's a great one. I didn't mention, but that's perfect. Relax, breathe, heat. Those are all wonderful, wonderful, different things. So I do have more information here on the PowerPoint that you can go through also, acupuncture, pressure points as well. I have a lot of information about newborn behavior as well, just normal newborn behavior. I did want to do a small tidbit on breastfeeding. Is it okay if I have 10 more minutes, guys? I know that you guys are fantastic, and I just want to make sure because I know that on the, okay, perfect, is on the paper where I asked everybody what you guys were most interested in learning about. Number 1 was labor and number 2 was breastfeeding. So I was like, oh man, I want to make sure I get to the breastfeeding. So just give me a few minutes for that. So there's different ways to feed your baby. Everybody's different. Some people want to breastfeed, some people want to exclusively pump, some people want to bottle feed, some people want to do both. It's whatever your choice is, that's the best. Just make sure that you are informed, that you make the correct decisions, and that you start your baby off in the best way possible for your goals. So for those of you who want to breastfeed, the most important thing that you can start out with is by skin to skin and by those golden hours. So before they would say the golden hour is 1 hour, but here's a little tip that I always tell my patients, I always tell my clients as well. Golden hour should not just be 1 hour, honestly. Golden hour should be at least 3 hours. That's where, and this is gonna blow your mind, but think about this, your baby's transitioning, especially the first few hours. Like even as nurses, we're like, all right, the baby's in transition. We even say, okay, the baby's transitioning for, 2 to 3 hours. So why do we say the golden hour is just 1 hour? That doesn't make sense, right? So our golden hour should be the first few hours, especially we should be skin to skin with our baby. That helps to control the temperatures, control the sugars, helps with breastfeed. It helps to even calm the baby down from the overstimulation, and it helps to transition the baby. So think about this. Babies, when they are cold, they don't shiver. They break down glucose. So what happens if you have a baby who's not skin to skin? Let's say they're covered in blankets and they have to control their own temperature. They're going to be breaking down sugar. However, what are they using to transition? They're using sugar. Therefore, you have this baby who's trying to transition to life, but they're using all of the energy that they have to transition. So they're not able to use as much as they can to, stay warm, to maintain their sugars, to breathe, to breastfeed. And when it comes to breastfeed, they have no sugar left. They have no energy left. So that's why I always say skin to skin, perfect, at least 3 hours, but honestly, you can do skin to skin up until whenever. 2 years old, you can still do skin to skin. It's good. And then yes, you can ask the nurse for excess skin to skin time rather than just 1 hour. This baby is your baby. And I tell that to my patients all the time. This is not my baby. This is your baby. So sometimes my patients will look at me and they're like, can I do skin to skin a little bit longer? I'm like, I'm sorry, did I birth this baby? I did not birth this baby. This baby was yours. So yes, you can ask for skin to skin time. You can even delay doing the weights, for example. Usually they do not recommend delaying the vitamin K and the erythromycin and the hepatitis B vaccine, but you can still do them all while you're skin to skin, if you're okay with that. Some people prefer skin to skin to be a safe place. That's why they prefer the baby to be under the warmer when they do injections. And some people prefer the skin to be home or a comfort, and to comfort the baby as they're doing the injections. So that is another thing. So if you guys also do end up, I have a prenatal package, which is fantastic, that I go over all this way more in depth, and I go specifically over things that you can ask as a patient that will help to get your needs met. So different things you can ask the nurses, different things you can ask the doctors, medical terminology to know. All those are really important. So try to do skin to skin as much as possible. When you put the baby to the breast, make sure that the baby, so here's a huge thing I see all the time. So I'm lactation in the hospital sometimes as well, in addition to nursing and the million other things that I do. And I see this 99% of the rooms I come in, the baby's wrapped up in the towel, not the towel, but the baby's wrapped up in the blanket. And then they're like, the baby's not breastfeeding. I see that all the time. And then they're pretty much like, the baby's wrapped up and they're just like this, the baby's not breastfeeding. And I'm like, how are you going to breastfeed a baby like that? So unwrap the baby, put the baby skin to skin, put the baby tummy to tummy. And then when you put the baby to the breast, make sure that you lift the breast up. So what I like to do is cross cradle for babies that are newborns, because it gives you a lot more control. So I lift up the breast here, I put the baby right here on the breast, and make sure that you're bringing the baby to the breast, not breast to baby. Baby to the breast, up and over. So what you do is when you have the baby tummy to tummy, you'll start to see the baby root around a little bit. So what you do is you express a little bit of the colostrum, put it on the baby's nose. Okay, that's the big thing. Nose, not mouth. When you give it to the mouth, the baby's gonna be bullseyeing you, and that's how the baby will get on the nipple. And if a baby's on the nipple, it's like sucking through a straw with a hole in it, and not much is gonna come out. So you do nose to nipple, and then baby automatically go ah as a reflex, and then make sure the bottom lip is flanged out, top lip is flanged out as well. And then you'll have a nice firm suck of the breast and be able to compress not just the nipple, but the areola, because the breast milk is stimulated not only by nipple stretching, but also breast compression. So if the baby's just on the nipple, you're having the nipple stretching, but you're not having breast compression. That's when you're going to get those bruising, you're going to get those blisters, you're going to get the compression stripes. It's going to be overall awful experience for you, which I know because that's how I ended up with my first baby. So all of these that I'm telling you was because of not only 8 years of experience on the floor, but also breastfeeding my baby and having a lot of issues over breastfeeding my baby, figuring out what worked. So like my first baby, like I said, had jaundice. He was under the lights. I was cracked. I was bleeding. I remember I would pump and blood would come out. It was awful. So then with my second, I made a lot of educational choices to be able to breastfeed effectively. And then with my second, I noticed it was a huge difference. I didn't have the bleeding. I didn't have the cracks. He had jaundice and it went away in one day, literally just one day, just by breastfeeding effectively. And he never had formula. My first baby had breast and formula. My second baby was just exclusively breast. So is it okay if I just talk to you guys about my program that I have, which is great, and then we can do my giveaway. So I have an amazing package also that I highly recommend for all of you guys who are expecting your baby. So a lot of people, they think of like a class where, you know, okay, let's sit through a class and we'll discuss all the stuff and I'll be prepared. But what happens is everybody's different, like I said, and everyone has different goals. So usually a one-on-one is a lot better because then you can talk about your specific goals and how you can accomplish them based on all those different methods that we talked about earlier, for example. So just how you can, let's say when you're pregnant and you choose an OB, actually what I do is you can actually be pregnant and choose me to be your lactation partner. So as you have an OB to follow you throughout your pregnancy, you can also have a lactation consultant to follow you through your pregnancy as well. And especially because, you know, there's different interests and it allows you to have a much more personal experience. So what I do is I do prenatal coaching. So I'll have 4 different sessions as you are pregnant. So this was literally 1 hour and we talked about so much. Imagine 4 sessions. So we talk about nutrition and exercise routines. We do a labor masterclass where I go more about labor and delivery. I go over how to have a lot less pain during childbirth. I go over also if you will have medication in your delivery, what to expect from a nurse's perspective, postpartum recovery, how to recover quicker after delivery, especially with those episiotomies, especially with how to take care of yourself, C-sections, how to avoid UTIs, yeast infections, complications to look out for, postpartum hemorrhage, things like that. And then baby care basics. We have a lot of first-time moms too. So how to take care of your baby over everything from a circumcision, if you're getting one, how to do the bath, all of that great stuff. So I do Zoom visits during pregnancy especially, and then you can also have a copy of the visit that you can look back on. So let's say we start, you know, next week and you deliver next month. You can have copies of all of our sessions, and then the day before you deliver, or even when you're starting to deliver or you're in labor, you can look through those, you know, you can do the labor class as you're in labor, you know, again, and go through it. And then I have a patient portal that you'll be able to look at all of that information. Then I also, in addition to the prenatal coaching, the same package has postpartum coaching because I want to make sure that we have the nice continuity of care, you know, between pregnancy and making sure that everything's okay after you deliver. So what I do is I do a hospital visit that I do over Zoom. And then that is crucial, especially, you know, if we can do it in the first day or so, especially because I can tell you what's going on. I can tell you if the baby's latched on from the beginning. I can tell you if the baby's jaundice, what you can do. Or sometimes your nurses don't have much time to tell you what different things mean. So at least if they say, you know, hey, this was high, I can tell you and spend time and say, okay, you know, this was high, this is what you can do. Then I have another session on the first week of life as you're transitioning home, second week, and then in the first month. And then what's great is just like before, you get a copy of all of the visits so you can look back on it. And then you can talk to me 24/7 if you ever have a question. So sometimes we'll have people I saw in pregnancy after the baby delivered, let's say baby had jaundice. We help them. Now they're, you know, off of jaundice, they're off of lights, and they have a question about, you know, should they do this, or they're pumping and they just changed pumps. So, you know, that all is included in the package. And then on top of that, I was thinking as a new mom, you know, what would I want if I was a new mom? So I would want the one-to-one coaching, but I'm also a tech person and I want to have stuff that I can just access whenever I want. So you have all premium courses at Mommy Did You Know? So I don't know if you guys saw them or not, but I have over 8 hours of videos. I have online breastfeeding classes, childbirth prep classes, baby care classes. So you get access to all of my courses that are self-paced. So they have like each day. So I have one giant one that has everything all together: childbirth, baby care, breastfeeding. Literally 2 weeks of it is just on breastfeeding. And it includes articles and tests and reviews and explanations. And this is self-paced that you can, in addition to our one-on-one classes, you can also get the self-paced classes as well and do everything just individually. And you can even do it with your significant other, you know, whoever you have. Then another one that I have is digital download. So I actually wrote 3 books. I literally wrote the book on breastfeeding. So you'll have access to my ebooks, the Safe Baby SIDS book, breastfeeding book, prenatal crash course. And then also I just developed a childbirth mastery toolkit, which I was thinking there's additional stuff that's like from A1, from Academy Pediatrics, from Medela, from, you know, so many different places that have all these great techniques. So what I did was I did a lot of research for you guys, and I put everything into one big toolkit, which has like 20 different PDF downloads that have like hypnobirthing affirmations. It has like 20 hypnobirthing affirmations. It has different pain relief pressure points and what they do. It has these breastfeeding cheat sheets, Lamaze breathing guides, CDC developmental guidelines from 2 months all the way up until I think it's like 2 years, essential oils and what they do, infant CPR. So all of these things, at least you guys like this class, right? At least it has a lot of great stuff. And then the beauty of this is that all of these have such a high value. It's like $800. But what I do is I offer it for $397. So at least it's a lot cheaper. And what it does, it gets the prenatal coaching, you'll have the postpartum coaching, the online self-paced classes, you'll get the digital downloads, the ebooks, and you'll get the toolkit, all of that. So you're pretty much going to be covered for pregnancy and postpartum for all of that. So I think that's amazing. So the way that you sign up for that is you can send me a message for one. So you can always send me a private message. You can email me, or you can go to this website on the website, mommydidyouknow.com/coaching, and you'll be able to sign up. It's also on the PowerPoint. You can actually click it directly. But what's really great is at least your payment is not required also until our first visit. So you won't even really need to pay until we even see each other for the first time. So you can always schedule to at least hold your spot, and then you don't even need to pay until the first one. And then you also get a 30-day money back guarantee. So let's say you go through it and you're like, hey, I don't think this is the best choice for me or something. You always can get your money back, or even, you know, in that period of time, if you didn't even schedule your first visit, there's no harm done anyways. So if you guys are interested in that, you can just let me know. You can send me a message, send me an email, and on mommydidyouknow.com, let me see if I can have over on the homepage for mommydidyouknow.com, you can actually see under consults, and you'll see prenatal coaching packages right here. You guys should be able to see here. But under consults, you'll be able to schedule consults. Under prenatal coaching package, it has a childbirth mastery package that has information, and then you'll be able to sign up there. So it has lots of great stuff. Let's share here the PowerPoint. Now I wanted to do a giveaway for the childbirth masterclass. So remember how I said that I have a super big class that's self-paced, that everybody can have information about pregnancy, labor, delivery, breastfeeding. So what I'm going to do is, you guys are fantastic. So I'm going to give everybody access to I'm going to give one person access to the childbirth mastery class for free. So that's the self-paced class that you will get. And the way that we will, I'm trying to think, let's do 1 to 10. So everybody that's in the class, just think of a number 1 through 10 and write it down. And then whoever has the number will win the giveaway. So I'm thinking of a number 1 through 10. Yep, just in chat. So just write it down in the chat. And I'll wait for everybody to have it. Somebody already did win, and I think that's 1, 2, 3, 4. So if that's everybody that wants to join, so we have, the winner was Rihanna, who won the Childbirth Mastery class for free. Yay, good job. My number was 7. Yay. So what you're gonna do is you have the free 26-day Childbirth Mastery class that is self-paced. It goes over everything from pregnancy, delivery. It has all those videos, like 8 hours worth of videos, a bunch of articles, all that good stuff. What you can do is send an email to mommy, mommy did you know at gmail.com, okay? Send me an email and say, I was the giveaway winner. Then I will send you the link in order to sign up for free. And then for everybody that wants to sign up for the coaching program, all you have to do is click this link here, because I just remembered I can put it in the chat room. So all you have to do is click that link there and make sure to sign up quickly, because at least hold your spot. The main reason is because I am only accepting 5 people after this month, especially. So we still have more time to go this month, but because of the nature of this program and how intensive it is and how much I want to focus on each client, I only am accepting 5 clients for this coming month. So you definitely want to at least hold your place, so at least you can get all that stuff. Oh, Rihanna's being nice, and she's saying, does anybody need it more than she does? Because she has access to another labor class. So maybe if, who was it that said that they were going to put it? Ariel. So if you wanted to, are you okay with giving her your free class? Or if Ariel, I'm not sure how to pronounce it, but. All right, great. So Ariel, what you can do is email me at that same email, mommydidyouknow@gmail.com, okay? And then just email me, say, I am the giveaway runner-up winner or giveaway winner, whichever you want to do. And then I'll send you the link to be able to sign up for free. And then at least you'll be able to get all of my classes and all of the articles and all that great stuff for free. And then the link is there, everybody. And thank you so much for doing that. That was very, very kind of you. Did you guys all enjoy your class? Maybe you guys can just explain maybe what was your favorite part of the class, or maybe something that you learned that you did not know before. I especially like to hear what people learn, because I like to teach. So if I'm teaching but nobody learned anything, then I'm like, well, what did I do? Because at least hopefully you learned something. But that's what's great about the coaching packages too, is that at least I can be one-to-one with people and teach and really be able to connect. I'm glad you like the intro to breastfeeding section. That was my favorite section too. I love talking about breastfeeding. Well, I think what I'm gonna do is make this class longer. I think I'm gonna make it like maybe once or twice a month and make it a 2-hour class instead. Because this, I just created this PowerPoint and this slide, and I even just created the coaching program as well. So at least I wanted to see how it'll work. But I think what I'm going to do is I'll make this class 2 hours. That way, at least with that, it will give me more time that I can talk about the newborn care and the breastfeeding and all that great stuff. So if anybody has any other questions, they can always ask me. I always have my email around, mommydidyouknow@gmail.com. So she thought it was, Rihanna thought it was interesting learning about the intensity of contractions with the forehead and the nose thing. And then I found it helpful for repeats on stuff I learned already. Then I know it's getting real instead of getting all my info from one source. That's true, because when you get to hear things from different people, it makes a big difference. So please let me know if you guys need anything. You can always check out my website, mommydidyouknow.com. I have a lot of great other resources and classes, and you guys can always ask me if you have any questions, okay? I hope you all have a good rest of the day, and I will be emailing the this video to you guys as well. You're very welcome.